So what is the signalment in these dogs? We usually see dilated cardiomyopathy in middle-aged or older dogs. Often they are presented in heart failure, so with the classical signs of that. But if we do, for example, screening programs, we can detect the disease already at an earlier age, so even in younger dogs. So that would be the case, for example, if a veterinarian would detect an arrhythmia or if there is a murmur. That would be another thing that could cause an earlier diagnosis. Usually this is not a sex-linked trait, so from the genetic side, but it appears to have a male predominance. So the disease, the dilated cardiomyopathy, is progressing in male dogs more rapid, and it is often in males a more severe disease compared to female dogs. So talking about the etiology, in dogs the vast majority of the cases is idiopathic. So we basically suspect a genetic defect, or we basically just don't know the cause of the disease yet. However, it is quite important to also look for other causes of dilated cardiomyopathy. For example, classical one would be taurine deficiency. We all know that taurine deficiency is a cause of dilated cardiomyopathy in cats. And it is also known for quite a while that taurine deficiency can cause dilated cardiomyopathy, especially in Cocker Spaniels. However, we also see that sometimes in unusual breeds or in mixed breeds dogs, where we detect a taurine deficiency as the cause of cardiomyopathy. Often these dogs are also on a lamb and rice diet. That has something to do with the availability of taurine in a combination of special rice brands and the lamb meat. Carnitine deficiency is another suspected cause of cardiomyopathy that is in the literature. However, this appears to be quite rare. There's just a report in boxer dogs where carnitine deficiency can cause the disease, but it is probably a rare cause for secondary cardiomyopathy. A quite interesting cause for dilated cardiomyopathy is tachycardia. So there's an experiment where you can take a pacemaker, implant that into the dog, and if you let the pacemaker run with a heart rate of 240 approximately, after 3 weeks, the heart looks like a dilated cardiomyopathy heart. Now you would think, when would that be the case that somebody implants a pacemaker and programs it wrongly? That never happens. However, there are in younger dogs sometimes special kind of supraventricular re-entry tachycardias, for example. And then this could be actually the cause of the dilated cardiomyopathy. So if you have a very young dog that presents in heart failure and you make a diagnosis of dilated cardiomyopathy, you have to think maybe this dog, which is usually too young to develop a classical dilated cardiomyopathy, maybe tachycardia is actually the cause of the DCM and not just a sign of the dilated cardiomyopathy. So that would be another important cause for dilated cardiomyopathy. Another cause would be toxic. For example, if you give doxorubicin, so chemotherapy, it is well known that this actually can cause dilated cardiomyopathy if you give doxorubicin at a quite high dose. But again, the most important cause for dilated cardiomyopathy is idiopathic or genetic. So let's talk briefly about the pathophysiology. So initially, we will have a decreased systolic function, which means instead that the heart pumps like that, it actually is contracting poorly. So there's a poor systolic function. As a consequence of that, the cardiac output actually drops. And this is causing then a drop in the blood pressure. And the body, the nature, doesn't like a drop in blood pressure. So there will be some compensatory mechanism that start at that point. So initially, there is a activation of the sympathetic tone. So the heart rate increases, there is a vasoconstriction, and basically also an improvement in the systolic function. The only problem is that this only works for quite a short time. So we need to activate some long-term compensatory mechanism. And the most important is certainly the renin-angiotensin-aldosterone system. So the activation of the RAS system basically causes an increase in blood volume. And if more blood volume returns to the heart, that will stimulate the myocyte growth and the replication of that. And this is causing a dilation of the heart, and we also called it volume overload. And basically this gives the disease also the name dilated cardiomyopathy, although in reality a systolic problem is the main problem in this disease.